I'm excited about the fact that we're finally getting some awareness of the fact that lung cancer is not confined to old smokers and former smokers.
Now, how in the world do you catch it?
Well, most of the time when we catch it successfully, it's when we find it by accident. Most of the time when lung patients present with symptoms related to lung cancer, such as coughing up blood or weight loss, it's often too late to have a cure. We still have adequate therapy, but cure is not likely. When we find them by accident, we usually can get a cure.
So, when you find it by accident, what does that mean?
Well, I have cases of a patient who had an automobile accident and the chest x-ray taken in the emergency room showed a tumor, and she ended up having a stage 1A cancer removed. That leads to the question of, should we be screening people? Should we be looking for them when there are no symptoms?
And you are now involved in a historic study to try to determine how to do that. Is that correct?
Yes, there's been a long-term international study called the International Early Lung Cancer Awareness Program, which is based in Cornell University. I am the principal investigator at St. Joseph's Hospital, also a participating agency. In this study, what we're looking for is the results of screening patients who are at risk. The at-risk population is viewed as patients who are smokers, former smokers, or first-order relatives. That may not find everybody, but we are studying it. If we can find cancers by accident or by looking for it, then we can usually detect it and resect it at a much earlier stage, leading to much better survival in the long run.
So this is part of that controversial idea. Should you get a CAT scan of your entire body and see if anything is wrong? Is that correct?
Yes, and we really don't support the idea of just getting the random scans. There's something very specific about the procedure in getting a lung cancer screening trial. For one thing, it has to be a very special kind of a scanner. The idea is to minimize the risk by lowering the dose of radiation, and the newer scanners will do that. We don't think that routine or older third, fourth generations of CT scanner is adequate for doing the screening. It should be done only within the confines of this study to keep the risks down.
And you have one of those devices?
Yes, we're installing, in fact, the latest our 256 slice scanner, which detects very, very fine data at very, very low radiation doses.
I think most people would understand how smokers or ex-smokers could get the disease, but how is it that people who don't really have any association with cigarette smoke can get it?
Yeah, that's a very good question that we don't really have an answer to. There are a lot of suppositions about environmental factors, and there might be predisposing genetic factors. One of the variables might be radon, for example, but we don't really know that for a fact. And the first supposition when a patient says they have lung cancer is, gee, did they smoke or did they live with smokers? We're seeing a significant increase in the incidence of lung cancer in predominantly middle-aged, more women than men, who have had absolutely no known predisposing factors.
So we don't know why?
We don't know, but that's under investigation. In fact, St. Joseph's has entered into an agreement with Georgia Tech to do an analysis of these tumors from a genomic and proteinomic standpoint. What that means is we're taking these tumors and analyzing them to see what is the pattern of genetic or protein changes that might tell us a little bit about the biology of this tumor that's different from the smoking-related tumors.
And what do you hope to do with this run walk?
Well, with the run walk, the main objective here is awareness. We'd like to increase the awareness so people know to look for lung cancer, to not be critical of patients who have lung cancer, presuming that they had a smoking history, and to raise some money because this research is very, very important, and we're about 30 years behind where we were in breast cancer.
So you need to get going, is what you're saying?
Absolutely, yes.
Thank you, Doctor.